Managing stress and keeping cortisol levels in check is a critical, yet frequently overlooked, part of reducing visceral fat. Chronic stress doesn't just affect the mind, it alters the body's entire hormonal and metabolic landscape in a way that directly promotes fat accumulation in the abdomen. Elevated cortisol, the primary stress hormone, signals the body to store fat centrally, particularly around the internal organs. This is an evolutionary response meant to protect vital systems during times of threat or deprivation, but in modern life, ongoing psychological stress creates a state of constant alarm that encourages visceral fat gain, even in the absence of overeating. Cortisol affects fat storage differently from other hormones. While it plays an important role in short-term survival, mobilizing energy during acute stress, long-term elevation causes the body to hoard fat, especially in the omentum, a fat pad inside the abdomen that wraps around internal organs. This visceral fat is highly metabolically active and contributes to inflammation, insulin resistance, and hormonal disruption, creating a vicious cycle. In fact, studies have shown that people with higher perceived stress levels or elevated cortisol levels tend to have greater waist circumference, independent of overall weight or body mass index, BMI. What makes stress management such a powerful tool is that it can shift the body from a fat-storing to a fat-burning state by recalibrating the nervous system. When we're under chronic stress, the sympathetic nervous system, responsible for the fight-or-flight response, dominates. Heart rate rises, digestion slows, and the body is primed to conserve energy. Through intentional stress reduction techniques, we can activate the parasympathetic nervous system, or rest and digest mode, which lowers cortisol, improves digestion, enhances nutrient absorption, and restores hormonal balance. Mindfulness meditation is one of the most studied and effective tools in this realm. Just 10 to 20 minutes of daily mindfulness practice has been shown to reduce cortisol levels, improve sleep quality, and even lower inflammatory markers linked to metabolic syndrome. It can be done through guided apps, breath-focused meditation, or even silent sitting. Over time, this daily pause helps retrain the brain's response to stress, decreasing the likelihood of emotional eating and breaking the link between stress and fat gain. Yoga is another holistic practice that combines physical movement with breath control and focused attention. It's particularly effective because it addresses both the physical and psychological aspects of stress. Research shows that regular yoga practice not only reduces cortisol but also lowers anxiety, blood pressure, and fasting glucose levels, all of which are tied to visceral fat accumulation. Even gentle forms of yoga can shift the body toward a more metabolically calm state. Deep breathing techniques, such as diaphragmatic breathing or box breathing, inhale for 4 seconds, hold for 4, exhale for 4, hold for 4, can lower cortisol in minutes. These practices stimulate the vagus nerve, which helps calm the nervous system and improve heart rate variability, a key marker of resilience and metabolic flexibility. Incorporating a few minutes of breathwork during a stressful moment or before bed can have cumulative effects on both stress resilience and abdominal fat reduction. Nature exposure, including walking in parks, hiking, or spending time near water, also offers profound stress-reducing benefits. Studies on forest bathing, Shinrin-yoku, in Japan have shown that time in green spaces lowers cortisol, improves mood, and reduces markers of inflammation. Even a 20-minute walk in a natural environment can help reset the nervous system and improve metabolic parameters over time. What's important to understand is that stress management is not just about relaxation. It's about interrupting a hormonal pattern that drives the body to store visceral fat. People who are constantly stressed, sleep-deprived, overworked, or emotionally overwhelmed often struggle with stubborn belly fat even if they're eating well and exercising regularly. Until the underlying cortisol elevation is addressed, the body remains in a state that favors fat retention, particularly in the abdomen. Making time each day for intentional stress reduction practices is not optional if visceral fat is a concern. It's essential. Whether it's a 10-minute morning meditation, an evening yoga session, daily journaling, or simply stepping outside and breathing deeply, these practices help reestablish balance in the body's stress response system. Over weeks and months, the physiological impact is measurable: lower cortisol, improved insulin sensitivity, reduced inflammation, and ultimately, less visceral fat. This isn't just good for your waistline, it's profoundly protective for your long-term health, including heart function, brain aging, and immune resilience.